Ms. O'Malley, I'm really glad you came to see me today. I am still unsure as to how this occurred. You know, it's probably best that you don't speak, okay? I'm sorry, I know better than trying to make conversation. I apologize. I'm worse than the dentist. Okay, so from the looks of things, this is a, okay, it's clear this is foreign matter. This is not anything that is supposed to be here. Do you live on, you can just blink once for yes, blink twice for no, okay? Great. Do you live on a farm? Okay, once, that's a yes. All right, got it. So that explains a lot of this, because from what this appears to be, it appears to be animal in nature. You know, whenever you used to play that game when you were a kid, animal, vegetable, or mineral, this is definitely in the animal kingdom from what I would gather. We're going to be pulling this out relatively quickly because it's one of those things where I don't see any indications of swelling. I see no indications of infection, which is very fortunate, quite frankly. And quite surprising, to be honest with you, because this looks to be a very deep sort of inclusion. That's what we call it whenever you have something that's actually deep inside a body tissue. So this is going as best that we can here. Getting everything very close to outside of the skin. It's so important that we move this quickly. So give me one moment, I have to lubricate the end of the tongs. And we'll continue with this. Great. All right, now on this farm, do you raise chickens? That's a no. Okay, great. Do you raise cattle? No. Understood. So it's maybe an exotic animal farm? It is. Understood. Thank you. Well, that explains what we have going on here, because this is definitely an exotic body. It's trying to make its way out of the tongue. I've made sure to give you a lot of anesthesia locally with lidocaine. I apologize for having to hold your tongue so firmly, but if you should move, it'd be one of those things where we might lose the foreign body back into the muscle itself. So it's really important that we keep a firm grip on your tongue, as well as on the matter that we are removing from the muscle itself. If at any time you feel a discomfort or anything like that, please make sure that I know by blinking quickly for me. We'll go ahead and give that a little test. Could you do like a rapid blink for me? Beautiful. A flutter is perfect. Wonderful. There should be no pain or discomfort from all of the anesthesia we've administered. So we're going to be removing this as quickly as possible. That's the thing I love about this. These sort of extractions usually take no time at all, as long as you have the proper technique and the proper equipment, which we both have here. So what I have here is a pointed pincer, and I will go ahead and get another dab of petroleum jelly on there. It's so important to keep this moist, because of course, as you know, the tongue is a very moist organ. It's also one of the largest muscles in the body, if not the largest muscle in the body. So whenever we add just a little bit of that, it can continue to, wonderful. The body moves out much more quickly. We also have to be very careful. Even though this is a very fast procedure, we don't want anything to happen so that it breaks off inside the muscle itself. It will continue to move very quickly out of the tongue, but if we get too rambunctious with it, it actually could break off inside. And I want to make sure that we avoid that at all costs, just to make sure that we don't have to worry about infection after the extraction. From the looks of things, this is really very healthy skin. It's very pink. It's very uniform in color. There's no bruising. There's no signs of trauma. I'm really interested to see what this is, how long it is, and honestly, where it came from. On an exotic animal farm, it doesn't surprise me that something like this should happen, but I'm curious as to the origin of this one particular parasite, because that's what it looks like. The good news is as well, as long as we remove this quickly without any sort of breakage, we don't have to worry about eggs or egg sacs. Exactly, because that could be a very specific and very interesting problem to have. Now, once we remove this, what we will be doing is prescribing an oral antibiotic, just to make sure that if there is any sort of material left behind and inside the tongue itself. Are you all right now? Mm-hmm. Great, okay, so sorry. Just want to make sure everything stays comfortable. Like I was saying, if there's any material or detritus left inside the tongue, we want to make sure that we use those antibiotics to head off and or prevent any infection that could occur, because this is such an incredibly tender and delicate part of the body. And it's also incredibly vulnerable to infections, especially whenever you have a puncture wound of this magnitude. This is truly impressive. All right, so it's moving very quickly. I'm very pleased with our progress here. We tend to have probably close to 8 centimeters already outside the tongue. And I continue to add just a little bit of the petroleum jelly to keep the body nice and moist, as well as lubricated, so that it can move out just as quickly and as easily as possible. And again, we want to make sure that we focus on keeping this in one piece as it exits the tongue. And please, if at any moment you experience any kind of discomfort or anything like that, or perhaps even numbness, make sure that I know by fluttering your eyelashes for me. By the way, you have beautiful eyelashes. So glad you came in to see us this morning. These kinds of things, you would be amazed how many people leave them to chance. They don't come in to see their medical professionals right away, and that can lead to severe injury and long-term, long-lasting effects, side effects, and sometimes disability. So I'm very happy to see that you came to see us. Thank you. Give us the opportunity to help you with this. Excellent. Now, do you have a lot of help on the farm? Yes? Good. Wonderful. I love hearing that. That's one of those things where this is the kind of injury that you want to make sure that someone is around to help you take care of once we finish the extraction, because it can be very, very delicate. The good news is you do have help, and it won't take much. Between the antibiotic and the bandaging, as well as the sanitary washes and rinses that we're going to give you, this should be absolutely just like brand new within probably 2 to 3 weeks. Wow, okay, we're continuing to extract the animal, the foreign body, and we're getting to probably 11 or 12 centimeters at this point. All right, Ms. O'Malley, are you experiencing any sort of discomfort? Wonderful, thank you. Okay, great. We continue to add just a little bit more lubrication every single time once we make any sort of progress in removing this foreign body. Great, okay. All right, now I'm noticing just a little bit of resistance here. We must be getting close to the end of the foreign matter, so chances are sometimes there will be hooking or small appendages that will keep us from removing the body as quickly as we'd anticipated. It's not a problem. What I'll continue to do is just very gently rock it back and forth, so that hopefully the grip that those small appendages have will loosen, and it will eventually come out of the tongue here. Wonderful. Good, good, good. Okay. More petroleum jelly to make sure that everything stays nice and wet. Moisture is so key in such a delicate procedure such as this. Okay, and we'll continue to very gently work this in a circular motion. We'll rotate it very carefully, making sure to keep the nose of the tweezers very close to the tissue itself, and the holding tweezers or spatula tweezers close to where the exit wound is. Wonderful. Great. Now, just to be certain, we're all very comfortable here, yes? Wonderful. Good, good, good. I must say you are excellent at the communication system here. I usually tell my patients something like that whenever they're in a compromising situation. They forget it immediately. Thank you so much. I know that makes it a lot easier for me. Hopefully it makes it more comfortable for you as well. Okay, and we continue to work in a circular motion, and I can see millimeter by millimeter it continues to extract from the tongue, from the muscle fibers itself, and we continue to change and move it very carefully and slowly. Okay, good. Great, great. In a situation like this, it's so incredible to me how quickly these things go, but you have to be very, very careful, especially right here at the end, because you want to make sure that everything goes as smoothly as possible without any sort of breakage. Because if you lose part of the organism inside the tongue, that can, like I said earlier, lead to infection, which can mean swelling. It can obstruct airways. It can affect your speech. So I want to make sure that we're always very, very careful about exactly what we're doing here. Great. And we continue to add the lubrication around the base of the foreign matter. I'm not seeing any sort of like fluids or lubrication around the animal, so I'm thinking that this is no longer a viable animal, no longer live, because usually if that were the case, it would be there would be some excretion, a lubrication that actually helps the animal move through the muscle. So what we're dealing with here is already a deceased organism, and that probably explains why this is moving so quickly. petroleum jelly to make sure that we stay on top of this. Oh, I'm so sorry. I know this is so terribly uncomfortable, but we're going to be finished with this in no time flat. You're doing a fantastic job. Thank you so much for your patience. And I continue to move the organism in a circular fashion. He continues to come out. Yep, we've got another centimeter out. So far I'd say we probably 15, 16 centimeters of organism that have left the tongue, which is great. And I'll continue to lubricate to make sure that we keep that just as moist and as soft as possible. It's so important to keep the tissue around this very soft, very moist, because if it doesn't, it can lead to tearing. It can lead to perhaps wounds getting even larger than necessary. So you're doing really great. Thank you so much for your patience. I appreciate you putting this procedure in our hands. This is probably the 5th one of these I've ever done. Most of the time it's usually from, say, a finger or a toe, or crazily enough, sometimes even a nose. But I have to say, the tongue is definitely a much more involved process. Even though it is a very quick procedure, it's very uncomfortable usually for the patient. I hope that we can make this as pleasant as possible for you. There we are. Wonderful. As we continue to use this circular motion. Wonderful. Okay, and here we come. We are right at the end of removing this entire thing from your tongue. Okay, if at any moment this starts to get uncomfortable, please let me know, but we're going to make sure that we have some really good motion going. I want to take advantage of it and completely remove it from the tongue. And, oh, we're almost there. I can feel it. Oh, great. Yes, 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 yes. Those vestigial appendages are starting to release, and, oh, there we are. Oh my goodness. What in the world?